good afternoon. Thank you for joining me on this Lunch and Learn. Today we're going to talk about mental toughness and residual effects from the pandemic. So we're going to be talking, they kind of go together, and we're going to talk about how this may be affecting you. Okay, so this first article about mental toughness was published from the University of Huddersfield in Huddersfield, UK. That's in West Yorkshire, I think. I used to live there, so if my memory serves, that's in that area. And it's all about mental fatigue and mental strength. Now, we do a whole lot of continuing education, as most health professionals do. And one of the things that struck me was the professor said that the human brain currently does not have any stamina, that people cannot hold a thought for longer than about 5 minutes, can't hold it as long as 5 minutes. And so I've kind of thought about that and have a thought kind of time where you are in that thought, and then watch how many fleeting other thoughts come your way to get you off track. I think that's just what we're living in. I think that just everything is so fast-paced that we've lost the ability to really focus. We've lost some of the art of mental toughness and mental stability. Now, this article says that the current pandemic has taken over 2 million lives worldwide. It has been profoundly detrimental on the mental health of billions of people around the globe. Research on Chinese citizens at the start of the pandemic found that symptoms of anxiety, depression, and stress were common reactions. These effects were mirrored in what other countries found, and they only increased over time. For example, in the United States, a recent study showed that 1 in 4 people suffer anxiety. In 2019, it was 1 in 10. So that is a huge increase in anxiety in Americans. For some, the increased anxiety and stress have also been accompanied by poor sleep, increased alcohol and substance abuse, which exacerbate mental health problems, so that makes them worse. All right? The rise in mental health problems during the pandemic cannot be attributed to a single factor. They are contributed, they're saying that these things contribute, is health worries, fear of dying, fear of a loved one getting ill, isolation, disrupted travel plans, disrupted social plans, along with media information overload. And so we do see this. Now, I will tell you, this year, since January, when the injections were approved, right, experimental use only, many people that I have talked to have gone and had their injections because they tell me it makes them feel safer. So this goes along with this anxiety, right? Fear of dying, fear of getting ill, fear of passing an infection on to somebody else. So they're going and getting these shots because it helps alleviate their anxiety. When I talk to them and I tell them, this is not going to stop you from getting any kind of sickness, and they go, yeah, we know, but if we get it, we're not going to get it as bad. Maybe, maybe not. It depends on what you're looking at. It depends on where you're getting your news. It depends on if you're going beyond the surface. I had an instance the other day where I was driving a lot, and I always like talk radio. I put on NPR, and of course we know National Public Radio, and they were touting the benefits of the injection. They were touting the number of people that had them. They were saying how we're just moving on to healthier and healthier populations. That's not exactly what I agree with, but this is the message that the news is putting out, and so this is driving people to make the health choices that they are making. Okay, it says, indeed, it seems that having mental toughness has helped many people to keep the adverse mental health effects in the pandemic at bay. Okay, so research has found that the psychological impact of the pandemic was greater among a certain group, such as women, students, and people with pre-existing health problems. New research has also found that for some people, having a certain personality trait seems to have some level of protection during these difficult times. So what exactly is mental toughness? Mental toughness is more than just having resilience and control during difficult situations, all right? In the book, Developing Mental Toughness, the psychologist Peter Clow describes mental toughness as a combination of the following. So let's do a reality check. Do you have this? Are you focusing on this? So the first thing is the amount of control a person believes that they have over their life and their emotions. So how much control do you have? Last year, when everything was shut down, nobody had any control. So everybody had a certain level of stress because of that. But your mental toughness is stronger when you feel that you have more control. How much commitment is placed on achieving goals despite hardship? That's another indication of mental toughness. I'm going to do this. Yes, I have obstacles. Yes, I have challenges, but I'm going to make sure that I get this task done. All right. Being able to see potential threats as opportunities for self-development. So a threat is not going to shut me down. A threat is something that I need to overcome, so I'm going to be a stronger person. I'm going to be a better person, all that kind of thing. Continuing to strive in challenging environments, if people can do that. The level of confidence a person has in succeeding despite obstacles, despite setbacks. So all of those things contribute to mental toughness. Now, I remember as a young woman, I remember having a boss that told me I could not do such and such, whatever. I can't remember the such and such was, but my internal response, of course I didn't do it external because he's my boss, but my internal response was, oh yeah, well watch me, I'm gonna get this done, and sure enough I did. And so that is a trait of mental toughness, and that's what we want. We want to engender mental toughness. So a person's environment, right, is relevant to their mental ability. For example, positive experiences while you're young and mental toughness training programs both have been found to make people mentally tougher. Mentally tough people can hold it together. Now, everybody loses it from time to time. There's nobody that doesn't lose it. Even Jesus Christ in the garden, he wept. He was in such mental agony that he sweat drops of blood. I've never done that. I've had mental breakdowns, emotional breakdowns. Some people could say mental too, but emotional breakdowns, especially with the grief of losing my husband. Other people have mental breakdowns when, a lot of people, when they lost their jobs because of the pandemic, when they weren't able to move forward, when they weren't able to travel, when a marriage falls apart, when children are sick, when siblings are sick. All of that contributes to mental breakdown. So we all have that, but we want to be able to recover from that. We want to be able to rebound from that, and sometimes we can, sometimes we need, medical help to be able to do that. So holding it all together. Overall, we found that reports of depression, anxiety, and stress symptoms were markedly higher in the pre-COVID times. Those who had lost a job or business, and we have a lot of people that lost their business during the pandemic, had a higher incidence of mental stress, all right? They had more symptoms with those afflictions. Even those facing temporary furlough are more likely to report high levels of distress. Now, I'll just tell you, with our children, we have 4 children that we, both of us have 4 children. And of those 4 children, I think 3 of them had full-time jobs. But 2 of those full-time jobs were hours cut back because of the pandemic. And there was a lot of stress that went along with that. We have our own business. We had some stress, not because we shut down, because we were an essential business, but people were too afraid to get out. And so, there was loss of appointments and that kind of thing because of just the stress of everything that was going on. So Everybody has been affected in one way or another, even temporary situations, all right? People who scored higher on the mental toughness questionnaire reported lower levels of depression, anxiety, and stress. And this is most likely because these people felt that they had a greater sense of control over their situation. They were more capable of staying focused under stress and better equipped to mentally cope. Mentally tough people who were also less likely to report depressive symptoms. So, what can you do to get yourself more mentally strong? Okay, you can do deep breathing exercises. You can do mental affirmations. Okay, you can do relaxation. You can do positive thinking. You can do goal setting. You can do you can read self-motivation, and you can also have self-motivation techniques. One of the things that we do and we encourage people to do is to do affirmations. I do affirmations every day, every morning. Mine are biblically based because that's just who I am, but you can do any kind of positive affirmation, and that's going to help develop mental toughness. Meditation will do it, prayer will do it. Like I say, just being mindful that I need to focus on what I can do, what am I in control of, so that I can move forward on that, all right? So I want you to be practicing that. We do have more control now. Things are open. Mask mandates, certainly in the state of Texas, have been eliminated, so that gives you even more control over where you go and what you do. I'll just tell you, the husband and I must be very mentally strong, because we would go into a place of business, and if they were enforcing the mask mandate, we just would tell them, you know, we want to spend our money here, we want to eat here, we want to shop here, whatever we were going to do, but we're not going to wear a mask. So it's your choice as the business owner if you want us to spend our money here or if you want us to go somewhere else. Sometimes they wanted us to go somewhere else, and we always found businesses that would cooperate with us and honor our own personal choice. So we had a lot of mental strength to go against the grain. We do know people, a lot of people, who did not have that. They didn't want to be the odd one out. They didn't want people looking at them. They didn't want calling attention to themselves because they weren't doing the, quote, right thing. And so that's just, there's no right, there's no wrong to this, but peer pressure, if you are pressured, then that is maybe a sign that you're not as mentally tough as you should be. Not that we did not follow. We did follow the instructions when it was, 15 days to flatten the curve. We surely did that. But after that, when we figured out what was going on, it was like, you know what? We're smarter than this, and we are in control of our own immune system. And I read the reports that wearing a mask does not prevent any viral infection. I mean, Dr. Fauci said that back in 2003. I know he said something differently, but the research still shows that the masks do not stop respiratory transmission. Just throwing that out there. Okay, so the second thing that I want to talk to you about is the post-viral complications from the pandemic. So you already know this, but you might not know that you know this, okay? Everybody has heard of chronic fatigue syndrome. Everybody has heard of that, right? Raise your hand. Yes, you've heard of that. Well, this is something that happens post-virus infection, where the immune system has not responded properly and still continues not to respond properly. Now, we know that the medical profession will lump this into the category of autoimmune diseases because your immune system is not strong enough to recover and rebound. But they are saying that there are some statistics from the most recent viral outbreak that show that this chronic fatigue syndrome is a thing. 2.5 million Americans suffer from this syndrome, okay? It says most people with this most recent infection have mild to moderate degrees of illness that subside very quickly. However, Some individuals experience ongoing symptoms of crippling fatigue. You may be surprised to know that post-viral syndrome can result from other common viruses. Regardless of the virus, when symptoms persist and health isn't quickly restored, it is important to find out why this is happening. Now, you may or may not know, you don't only have a virus when you feel ill. Everybody has in their DNA package in the microbiome. You have viruses. They're stealth viruses. That means you have them, but they're not doing anything to you. They're not presenting. They're not making you sick. They're just there. So most of us go on about our merry way and don't think anything about it. But then when you have a series of assaults, insults, either emotional, physical, mental, whatever, all of that serves to break down your immune system, and those stealth viruses can then start to manifest and make us sick. One of those is the Epstein-Barr virus, and we've talked about that in the past, that 95% of adults in the North American continent, so that's Canada, the United States of America, and Mexico, all of those countries, 95% of adults have the Epstein-Barr virus in their cells. Now, what makes somebody like me not have any symptoms from somebody that may be having a symptom can be stress provoked infection. I have a friend, her husband died of complications from Epstein-Barr. Now, the Epstein-Barr wasn't the first infection. The first infection was a flu. The flu, for whatever reason, he was run down. It changed into Guillain-Barré syndrome, which is part of the Epstein-Barr presentation. And he did not survive that. So it's not like this is something that's really, really rare. This is something that everybody has, 95% of adults. So we want to make sure that we know that most people have the cytomegalovirus. Most people have human papillomavirus. Most people have one of the herpes viruses, right? Most people have Epstein-Barr virus. So all of these things, the monovirus, all of these things are just in the DNA. And if we keep our immune system high, if we keep our food intake organic and nourishing and full of enzymes, and we keep our thought life, our love life, all of those mental things in a good situation, then our immune system is not going to crash and burn. So the post-viral syndrome, also known as post-viral fatigue or post-viral fatigue syndrome, isn't a new phenomenon. It's just a new name for the very old chronic fatigue syndrome. It is important to understand that individuals can experience ongoing symptoms and reaction following Epstein-Barr virus, severe acute respiratory syndrome from the SARS-CoV-1 virus, the West Nile virus, okay, H1N1 influenza, and many others. So those are all the things, right? Those are all the things that we're looking at. Those are all the things that we already have inside of our body, right? These viruses can leave patients experiencing long-term fatigue and malaise for months. What is malaise? Malaise is depression. I don't have any energy. I don't have any want to. I don't have any motivation. I'm just tired. I'm just tired. So it's a physical tiredness. It's a mental tiredness. It is an emotional tiredness. If left unchecked, people can go on to develop autoimmunity and chronic disease. So this is a progressive situation. The World Health Organization tells us that the majority of people will recover from viruses anywhere from 2 to 6 weeks. Those who have had severe cases of any viral infection can expect longer recovery time. In fact, the Journal of the American Medical Association published a study that showed that 90% of the current viral hospitalized patients still had persisting symptoms after 8 weeks. One of the most persisting thing is the cough, okay? The cough does go away, but it persists for a very long time. As we have seen with other viruses, the current virus has the potential to trigger chronic disease. Oftentimes we see various forms of viral and other illnesses trigger an autoimmune disease. fibromyalgia, or chronic fatigue syndrome. All right, so this is what we're looking at. Chronic fatigue syndrome, according to the Centers for Disease Control, is estimated that 2.9 million Americans struggle with this at some part of their life. These conditions are characterized by extreme fatigue that cannot be resolved with rest. Oftentimes, the exhaustion is debilitating. You may have friends that just can't get up off the couch, or you may be someone like that. You're just in the bed all the time, and no amount of rest is going to give you the relief that you desire. These are things that we can help with, because why? We go after the root cause of the dysfunction or the disease. We don't treat the disease, okay, because I'm not a medical doctor, I'm a holistic practitioner, but we go after the cause of it, and we get your body, we help your body to return to health. You are the only one that can heal your body. All right, so it is important to understand that the post-viral syndrome symptoms are virtually identical to chronic fatigue syndrome. Sufferers show chronic fatigue symptoms as well as shortness of breath, loss of smell and taste, brain fog, and digestive distress. Interestingly, brain fog and digestive distress often go hand in hand due to the connection the gut and the brain have. Now, we've shown you this before. I'm probably going to post it in the comments, but there's something called the ripple effect. When you are digesting your food, absorbing your nutrients, and you are repairing your tissues, you have health and you have restoration. When you're not digesting your food, and I would say of all the people that come in to see me, probably 90% are not digesting their food properly. And so when that happens, you're going to have a poor gut-brain reaction, and this is a foundational problem that we need to address so that you can regain your health. All right, so does that make sense to you? Chronic fatigue and weakness with exertion, physical and emotional or cognitive, are also traits of chronic fatigue syndrome. Unrefreshing sleep, we said that, impaired memory and concentration, muscle pain, joint pain, sore throat, tender lymph nodes, and headaches. All of those are symptoms that go along with chronic fatigue. Sometimes, I would say most of the time, chronic fatigue syndrome stumps the medical community, as there is not a clear-cut treatment in their paradigm. And that's right. Why is that? Because medicine looks at your symptoms, labels it, gives you a medication to suppress the symptom. They do not go after the cause. Holistic medicine, on the other hand, we look at your symptoms because that's important, that we give you relief from the symptom. But we go beyond the symptom to the cause. We find out what the cause is. The cause could be viral, could be parasites, could be heavy metal, could be chemical toxicity, could be a fungal pattern. The list goes on and on and on. And so when we find that through our energetic testing, we seek to resolve that issue, which will get your body at a healthier vibration. When it's at a healthier vibration, it is able to knock the disease out. Remember what I always say, drugs are not going to heal you. Herbs and supplements are not going to heal you. What is going to heal you? Your own immune system. What do we do here? We work with your body with nutrition, food-based, plant-based, in most cases supplements, to get your body doing what it needs to do so your own immune system can mount a defense against what we're looking at as far as the chronic fatigue. So these are some of the causes, right, and some of the issues that can lead to chronic fatigue and autoimmunity. Celiac disease. Now, celiac disease is when you are born with a gene defect that you can't process gluten. I will just tell you, I heard a medical doctor say they used to ask, to what degree are you sensitive to gluten? Now, because the wheat is processed with 2 applications of Roundup, which has glyphosate in it, which is a heavy metal, they don't now ask you to what degree are you gluten sensitive, because everybody is gluten sensitive now. Other food sensitivities. Why other food sensitivities? Because with the heavy metal, with fungal patterns, a lot of you that do essential oils internally should not be doing that. Essential oils are volatile. They will burn a hole through the GI tract, through the mucosis. That causes those folds, shingles, scales, whatever you want to call it, that keep the food inside the GI tract. It opens them so that minute undigested food particles get through the GI tract. We call that leaky gut, or as one of my professors calls it, passive leaky gut. When you have that, then those undigested food particles get into the bloodstream, and then the immune system goes, hey, we got a foreign invader, we need to go and attack it. And so this sets up some autoimmune conditions there. Heavy metal toxicity, which we talked about. Glyphosate toxicity, we talked about that. Chronic infections, which is what? Stealth viruses. Mitochondrial dysfunction, all right? What is the mitochondria? Well, going back to 4th grade health, your mitochondria are the little organelles inside the nucleus of every cell that is the powerhouse of the cell. They need certain nutrients, they need certain vitamins, they need certain things to be able to do what they need to do. And when we're not able to do that, then we go into a disease process. Sometimes this is a DNA problem. We do DNA testing here, and we take a swab of your cheek on both sides. We send it off to a lab in Austin, Texas, and they send us back your results, and if you have any gene SNPs that we need to work with in order for you to be healthy. Now, unlike Ancestry and unlike 23andMe, this lab does not share your DNA with any governmental agency, does not share it with Google. It is just between the lab, you, and me, not anybody else. And so you can trust that that's very, very safe. Your information is not going to get out there on the World Wide Web, okay? And so we want to make sure that we know that. Also, there is mast cell activation and elevated histamine response. Each of these things can cause immunity issues. Each one of these things can cause chronic fatigue syndrome. So I know that's a lot of information for you, and your mental toughness just might be going, oh man, I just can't cope with this, okay? And so if that's something, then you need to maybe break it down into smaller parts, do your affirmations, and get your brain a little bit stronger, because we need to have a strong brain in order to survive. There's just a lot of things out there that are harmful, that are hurtful, and if we feel like we have no control, we're going to fall victim to these other things. So hopefully you've learned a lot here. If you have any questions, pop it in the comment box. We always get back to the comments. Okay, so Janie says, even doTERRA shouldn't be taken internally. Yes, every oil company, every essential oil, especially pure essential oils, and doTERRA is one of the better ones, okay? So we like that. What we want to know is that all essential oils are volatile. They all are. They will all go through the GI tract and burn holes in it. So I was talking to a lady this week who has 4 doctorate degrees in using essential oil as medicine, okay? And she says you should not do them internally. She said, we had a lady that came in and she wanted to use essential oils for a specific malady that she had. And the lady with all the doctorate degrees said, if she insists on doing that, then she needs to write a letter giving you indemnification. That means she's not going to hold you responsible for kidney failure and liver disease. So that's what happens when you do essential oils internally. Those are some of the risks that you take. So just be very, very careful. Do your research. I know both doTERRA and Young Living say that you can do that. If you do that, Robert Tisserand, I think, who is like one of the leading world experts, he says you can only do them internally under a doctor's supervision, and only if the doctor has an insurance policy that will cover information, will cover incidences that occur from essential oils going against the body. Remember, you get 100% efficacy of an essential oil if you put it in a diffuser. You get only 25% if you put it on topically. So why are we using essential oils? We're using them for health benefits, and I do. I have my diffuser going all the time, but I get 100% of the benefit if I am doing it in a diffuser. I only get 25% efficacy if I put it on. Do I sometimes wear essential oil? Yes, I sometimes do. Not often, but I sometimes do. I always put it in a carrier oil. I don't just do it neat, I do it in a carrier oil. So that was a great question. I appreciate that. Any other questions that you guys have, like I say, pop them in the box. My time is up. It is the weekend. I want you guys to love on yourself, do a lot of self-care, enjoy the sunshine. It's summer. I think most people are out of school now. And so go out, enjoy yourself, and I will see you next week. Thank you so much.